All right, now to motherhood. Los Angeles is one of the several places around the country that are enlisting doulas to try and improve the birth outcomes for moms and babies. Specifically, the target is African-American mothers-to-be. That's because here in LA County, new black moms die at disproportionately high rates, and their babies are 3 times more likely than not to make it to their first birthday compared to white infants. KPCC's early childhood reporter Mariana Dale has been reporting on this. Hello.
Hi, A.
Okay, so first, let's clarify, what exactly is a doula? What do they do?
Well, let me start with what doulas are not. They are not doctors or midwives. They do not deliver babies. They don't give medical advice. They're another member of the birth team. And what they do is provide educational, emotional, and physical support during pregnancy, at delivery, and postpartum. And I know all of this because KPCC and LAS surveyed more than 20 California doulas, including Michelle Sanders, who wants to clear up some misconceptions.
So people think that doulas mean that you are having a home birth, unmedicated, what people call like hippie or crunchy. And it's just like, no, whatever you want to do is what we'll support. It's not about how I would do it. I just want you to do what you want to do in a safe way.
And so here's an example she gave me on that. Sanders can go ahead and explain all of the medications that might be presented during birth so that when a doctor asks you about Pitocin, which is used to induce labor, people know exactly what they're accepting or declining.
I gotta admit, I thought it was hippie and crunchy too, what a doula does.
Yeah, that's why we're talking about it.
All right, so what are some more examples of what this support looks like?
So there are those 3 phases I talked about. So before birth, that's where doulas can help you make a plan for what kind of birth you want to have, with or without medication, help you with some stretches, help you prepare for baby, and basically just answer any questions that you might not have time to ask your doctor. Then there's the birth itself. They're going to help you advocate for that birth plan that you planned out. They might help with massage or other types of pain management techniques. And then after baby is there, there's postpartum. So maybe mom or the family needs help breastfeeding, a mental check-in, or maybe you just need someone to do the dishes or watch the baby for long enough that you can take a shower. Doulas do all of that.
Is there any research that doing all of those things you just mentioned helps improve birth outcomes?
Yes. So there's been a couple of studies. A few years ago, there was one of Medicaid-funded births. It found that women who worked with a doula were less likely to have a preterm birth or a cesarean section. And then there's kind of an added financial bonus, which is that it saves health insurers nearly $1,000 per birth is what they found. And then the American College of Obstetricians and Gynecologists has also said in the past that continuous support during birth, which is basically what a doula does, is one of the most effective tools to improve labor and delivery outcomes.
All right. All sounds great. But how are people paying for their services?
Yeah, where's the money?
Yeah.
Most of the time that money is coming out of people's own pocket. There is a range. Some doulas charge a couple $100. Others charge a few $1,000s.
What about health insurance for that?
That is the most frequent question that I've gotten as I've been working on these stories. Will my health insurance pay for it? And the related question, which is why won't my health insurance pay for it? And so I reached out to some of California's biggest health insurers, Blue Shield of California, LA Care Health Plan, United Healthcare, and Kaiser Permanente, and none of them cover doula services. It's not considered what they call essential to maternity care. Kaiser and LA Care Health Plan say they're actually looking into the possibility of covering these services in the future. And United Healthcare told me that people who have a health savings account or what's called an HSA should actually be able to use some of that money for a doula.
All right, so back to what's happening in LA County. What is the county trying to accomplish with its doula pilot program?
I'm going to let doula clinical consultant Nikisha Robinson actually answer that question.
We're hoping that the outcomes for the women that are participating are positive birth outcomes, that babies are going to full term, that babies are living and thriving.
And here's the plan for that. This pilot program is going to provide free doula services to African American moms in specific parts of the county, and there's going to be a priority for people that use Medi-Cal.
All right, so what happens next?
Well, there is a hope that these types of pilot programs can prove that doulas really do improve outcomes in a significant enough way that maybe Medi-Cal or private insurers are going to cover these services. Oregon and Minnesota, for example, those are two places where doulas are considered a covered service for Medicaid. And in the meantime, I should mention there are also some community groups that are working to offer doula services at free or low cost. They're kind of filling in the gap.
All right, that's KPCC early childhood reporter Mariana Dale. Mariana, thanks a lot.
You are welcome. And if it's possible that UA or anyone out there still has questions about doulas, you can.
I might.
You might. Well, I can tell you where to go.
Okay.
You go to our website, laist.com. That's laist.com.